the only moon who fails out of medical school. Oh no, what am I gonna do? The test is tomorrow. Oh gosh, you got my note. Welcome. Oh, sorry, I know I'm a bit frazzled. I have a test tomorrow. Oh. What do you mean? I mean, you got my note, right? Did you read it? Oh, I tried to make it sound cool and friendly. I even added hand-drawn emojis. To keep it current. What did you expect me to do? I didn't have your phone number. You left so quickly last time, which, by the way, that friend of yours visited me. Yeah, the cool goth one. She was really cool and also really intimidating. Like, so intimidating, but also really cool. I can see why you guys are friends. But please don't send her back here again. Oh, yeah, let's write the note. What part did you not get? Oh. Well, I thought you were cool with supernatural creatures. Ah, I understand. It was a surprise to have a group of school gnomes trampling into your classroom. I get it, but that would take anyone by surprise. Were they nice? Oh, I mean, they kind of have like a gang, you know. And there's like infighting between the gnomes with the gangs, and they're trying to get matching jackets. It's actually really cute. I love really small things. Did they start a fight in your classroom? Yeah, no, my bad. My bad. I didn't know that territory was like that particular group of gnomes, like domain. I didn't realize the infighting had gotten that far into the school. You know, they live outside and. Sorry, I get myself worked up. But you're gonna help me, right? Right? Hmm. You just have to. I can't fail. Not another test. When I went home a few weekends ago, everyone was there. Wolf packs. And they asked me how school was going. And my mom proudly said she got a 74 on her practical exam. And then everyone stopped howling. Like all of a sudden. I had never heard everyone that quiet before. Ever. So, do you think I can, test my practical knowledge on you again? And this time you can't tell your friend. Good. I don't need her sniffing around, by the way. Thanks again for helping me. You really are the best, and sorry about the gnome situation. But this time don't leave without giving me your phone number. Okay. Let's do some deep breaths. Oh no, the exam hasn't started yet. This part's for me, not for you, unless you too would like to do some deep breaths with me. Allergies. No, I'm not nervous. Is it that obvious? I'm working through it. Now back to the deep breathing. You and me, we got this. Luna Moon, future doctor of werewolves and humans and, other supernatural creatures. Maybe. It just depends on if they're in network, of course. Right, the breathing. Okay, together. Was that good? Do I feel less anxious? No? Another one? You got it. Okay, you can do this, Luna. You can do this. Werewolf Doctor. Okay. Don't tell anyone I just did that. So embarrassing. It really gets the wolf out of me when I get nervous or frazzled or anything to do with school, really. I have test anxiety. I have anxieties about most things. But somehow you put me at ease. So thank you. All right, patient, go ahead and take a seat. No, you don't have to take off your clothes. This is just a fake exam. You don't have to put on a gown or anything. Please put your clothes back on. Well, I'm not peeking. Okay, good. Ooh. All right, patient, welcome to my clinic. More natural, Luna. And welcome to my clinic. We'll just go to the next part. What brings you in today, patient? Just a regular checkup. Don't worry, I can do that. No, this isn't part of it. It got stuck. Yeah, no, I can do checkups for all manner of species, including humans and werewolves and banshees and gnomes, and I don't have to list them all here right now. Seeing as you're a human, I can do a checkup for a human. Can do. So, anything you'd like to discuss with me beforehand? Is there anything else you feel like I should know? Like, have you been under the weather at all? Have you noticed any changes in any patterns? Like eating or sleeping or any emotional disturbances? Emotions and physical well-being play a very big part together. Most doctors should ask this. It's still weird that human doctors don't. That's right, they have specialties. That's so weird. No, you haven't noticed any changes, but it's time for a yearly checkup. Good human. Sorry. Besides that, would you allow me to sniff you? Remember, it's impolite to sniff werewolves or any species without their consent, so always remember to ask. Good, I have your permission. Alright. I'm approaching now. Have you been outside recently? Yeah, no, I get it. Weather, what are you gonna do about it? And it smells like you ran through flowers. The gnomes chased you. Again, that's my bad. My bad, not you. But other than that, everything smells relatively okay. I don't smell any infection or anything to be too concerned about. While I start filling out your chart. Wait, no, that came out awkward, huh? Okay, no, I can do this. You can do this. We got this. You and I together. We're doing it, okay? Okay, if you would be so kind. No, Luna, I'm gonna fill out your chart. Okay, I'm filling it out. And while I'm doing that, patient, if you could please place your hand right over here. Yeah, on this sensor. Yeah. It's going to check your blood oxygen levels and your heart rate. Just other necessities. Could you imagine if I had to do this in the olden days? I would have to prick your finger and take it to the lab. Future technologies. Though I don't have one of those fancy machines that do the measuring for me. Yeah, they're automatic. They're really cool. They just go. Yeah. And it just tells me exactly how tall you are. So unfortunately I have to do that part myself. But please, it's not going to hurt. Just place it on the sensor, and once it beeps you can remove your hand. Yeah, no, just line up your... Yeah, no, it's okay. I don't mind explaining. In fact, most of the time people think I over-explain way too much. Silly Luna. Please don't make that joke again. I know my name means Moon. Why did my mom hate me? Okay, now you're just gonna line up the fingers and place it, yeah, just like that. Place it there, perfect. And I'm gonna go get the chart, like a real checkup. I mean, this is a real fake checkup. No, if I did this, it would be real. In the, I'm gonna get your chart. Okay. Sensor's still going. You're still feeling okay. Are you feeling comfortable with me? Kind of. I know I'm a little intense. Okay. Name. I already know it. But in the future, I would ask for your name. Remind me of your date of birth, please. Okay. Alright. And reason for visit is just checkup. And the smell check was good. And didn't notice any signs of distress. Mentally, we're feeling sound. Okay. And is it done? No, okay. Just a few more minutes, that's alright. I'll continue to fill out a few things so this looks very official. I'm not writing anything down actually. It's more so I don't have to make awkward eye contact while I wait for that. I won't say that part to the patient though. Isn't it funny how doctors always seem to be writing everything? There's never like even that much on the form to fill out. Oh, is it done? Good, okay. Blood. No, I'm actually writing good things. And good. Oxygen levels. Okay. And there was no changes in diet. Okay. Perfect. All right. Official checkup time. Don't worry, I won't say anything too crazy. Though sometimes I get confused depending on the species I'm looking at. So if I say anything that you take offense to, or if I start panicking because, for instance, your heart rate level seems very low to me, but then I have to keep in mind that you're a human and not a werewolf, which we tend to run much higher, faster metabolic rate. Then I won't panic. But if I do, just remind me, hey, Luna, flip over the chart. It's the wrong chart. That's right. Okay. I'm first gonna begin by taking a look at your nails and your I was going to say fur, but I think hair is a better descriptor. It tells a lot about health and whether or not your body is metabolizing the right nutrients. Do normal doctors not take a look at that? That's weird. That's really weird. I also might take a look at your glands, your teeth, and your ears just to make sure that everything is a-okay. Again, so weird. Alright, let's begin, patient. I mean, you are my patient. It's just you know, I also consider us friends. Even though I didn't have your phone number, which this time I'm not letting you leave without. No, I'll let you leave. It's just I'm gonna put this down. Okay, patient. Do I have your permission to check your hands first? Okay, good. All right. It doesn't matter which one you would like to start with. Okay. This one. Okay. My left. You're right. You didn't need to know that. You already knew that. Okay. Sorry, I'm nervous. Is that obvious? No wonder why I keep failing the practical exam. Okay. We got this. Alright. If I can just... Thank you. Alright. Looks okay. Good. Alright. And if you can just make this for me. Yeah, just like that. Okay. Good. You don't feel any tenseness? Nothing hurts? Nothing popping? Good. And overall, this hand looks pretty good. Okay, next hand. Thank you. All right. Oh, was I too rough? Oh, I'm sorry. Werewolves tend to be, a bit stronger than regular humans. Keep that in mind, Luna. I didn't mean to be too assertive or aggressive. Your comfort is my main priority. It is. Okay. I promise I'll be gentler this time. Alright. Okay. Everything looks to be good. Okay. Perfect. And the fist, please. Good. Alright. And if you can, that's right, you can't retract your claws, fingernails. That's fine. We can skip that step. But overall, your nails look relatively healthy. I don't notice any kind of like percolation. When it kind of starts to get a little see-through, they don't appear brittle at all. And overall, your nail beds look a nice, healthy color. I think for humans. So good job. Means enough oxygen is running through your body. Next, that's right. Next, we're going to be taking a look at your your hair fur. Your hair. Do I have your permission to feel around? Okay, good. Let me know if I am too aggressive or you feel uncomfortable at any time. Okay, here I go. Gentle, Luna, gentle. Doctors are gentle. We're not scary. I'll start with this side. Alright. Looks good. No matting. Everything looks to be okay. Let's check this side. Okay. No matting on this side. That's good. Back over here. Okay. Has a nice luster and shine. Again, good for pinpointing any missing nutrients that your body may be having either a hard time metabolizing or you're just not eating enough of. And if that were the case, we'd either have to do more intensive tests or prescribe you some medications like fish oil, for instance. Salmon's really good for healthy coats. Hair. Not coats. Hair. This is a human, Luna. Great. Alright. But other than that, it looks really nice. Good job. And you haven't been noticed any excess shedding? No. Okay, that's good. Now I'm going to feel around your neck just to make sure that there's no swelling. Okay. If you want to just tilt your chin up for me. Okay, thank you. Alright, that's good. And it doesn't hurt when I press, right? Good, okay. Good, alright. If you can just bare your fangs for me. Your regular, your human teeth, not fangs. Unless you have fangs, I'm not judging. Mine are not that aggressive at the moment. You know, it varies depending on how close it is to that time of the month. The full moon. Not the other thing, sorry. Am I blowing this? You're a great patient. You're doing so great. It's me. Are you feeling confident in my abilities to treat you? I got bad marks last time, which is why I'm asking. You are. Okay. You're not just saying that, right? You're not just saying that to be nice. Thanks. It means a lot. Yeah, okay. Teeth, please. Okay, good. Alright, good. And you're not having any issues with chewing any specific foods, either temperature-wise or texture-wise? Good, alright. And you haven't been noticing any issues with your ears, correct? Would you mind if I just take a quick look at the ear canal? I have to remind myself that your ear canal looks different from my ear canal. Okay, let me know if I'm too rough. Alright, I'm just gonna come over here and gently take a look, feel around. Good, okay, and over here, if I can just, good. And you haven't been noticing any ringing or any swelling? Does it sound like anything is underwater? No? Okay, good. Positive signs. Let me write this down and we can move on to more specific tests of the checkup. Don't worry, this time I won't make you do a smell test. Plus, I don't think my samples would really work for a human patient at the moment. Last time you weren't even able to smell the faint traces of things. I'll have to get a better tailor-made scent profile for human noses. That will be for next time. That's right, the chart. You're being a real trooper. Sorry, chart. I'm just gonna... Okay. Alright. Patient passed all physical exams. Nail health good. Fur health good. Teeth health good. Ears look good. Nose, I'm gonna write a question mark, but seeing as you said that you weren't having any issues, I'm gonna take that as a positive sign. Good. Alright. Good. Alright, now we're just gonna take a look at your overall eye health today. If you don't mind, we're gonna do a couple of tests. I'm gonna have you follow my finger. We're gonna do some like basic eye tests, and then we're gonna turn down the lights, and you're gonna tell me if you still see things. Like, is that only for werewolves or also humans? Do regular doctors turn off the lights so you can check things? No. Sometimes eye doctors do. So is that a yes or a no? Is that... hold on. This is not part of the exam. We'll do it just to be safe. You know, humans don't have, like, good night vision, do they? I didn't think so. Okay. We'll test what I know I should test. You can have your full confidence put in me, Luna Moon, future MT, if I pass this test. Oh no, that means I have more tests after. It's fine. Right, patient. Eyes. Alright. Now, we'll do some, like, periphery exams. So I'm going to have you look right at me, and I want you to only look right here at me. Do not look anywhere else. No matter how exciting or exhilarating you might find this test. It's not. I was just hoping to add some pizzazz. Stick to the script, Luna. Okay, look right at me, please. Great job. Now I'm going to wiggle my hands. Close, far away, and I want you to tell me if you see the hand closer or farther. Okay. Good. But remember, don't look at the hand. Don't move your eyes. Just remain looking at me. And we're just going to check your peripheries. It's a fun word. That's the test. Okay. Here. Official. Starting now. Okay. Closer or far? Good. What about now? Good. Okay. How about now? Good. 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 Good. Okay. Now I'm just going to have you follow my finger, only till you can't see it. And if you notice any eye strain or any pain or any blurriness in your vision while looking in a certain direction, let this werewolf doctor know. Or regular doctor. I didn't need to preface the werewolf part. It's fine. We're all learning here. Got it. Alright. Now, I'm going to follow this finger. Is that okay? Comfortable with that? Good. Alright. Now just follow my finger till you can't see it anymore. Good. Any eye strain? No. Good. Any blurriness? Good. Good. Alright. Now we're going to do it in the opposite direction. We're going to go vertical this time, up and down. Good. Any pain? No? Good. Any strain? Good. One more time. Good. No blurriness? Wonderful. Good job. You passed those tests. So your peripheries seem okay. Vertical and horizontal. No eye strain. No blurriness. No pain. Right? Good. I don't notice any redness or any puffiness, so that's good, but I don't think that would explain anything. I should check that before the start of the test, huh? Oh, that would have been a -5 points. That's fine. I'll make a note on the chart. That's very official. Let me go write down your results. Get it together, Luna. Okay. Reminder. For eye exam, check eyes. I'm underlining for importance. But you passed that test, you passed that test, you passed that test. Good job. Next, we're going to move on to just a simple familiar eye exam, and then we'll turn on the lights and we'll do it a second time. For maybe humans. I'll have to double check that. Okay. Okay. Patient. Are you familiar with one of these? Good, okay. Well, gonna be relatively simple, pretty, I think, standard for both supernatural creatures and humans, like you. You don't need to remind them of that, Luna. Okay, for everyone, should be relatively simple. Are you ready? Good, alright. Can you read the second line for me? Good job. All right. Any blurriness? Were you able to read them correctly? Good. Okay. Now we'll move on to the next line. Can you tell me that letter? Good. All right. What about the next one? Good. Okay. This one? Good. All right. Do you want to move down to the fourth line? Okay. This letter right here. Good. Next one. Good. Next one. A Z. Good. Next one. Good. All right. I'm going to turn down the lights and we'll go through this a second time. I think that's right. Humans do that. Yeah. No, they totally do. Okay. I'm going to turn down the lights. All right. Now, we'll start with the second line again. I notice you squinting a lot. Can you read it okay? Kind of. Okay. And then the next, you're doing this a lot. Okay. What about the third line? What is that? Oh, that's kind of right. Okay. Next one. The next one. Is that not? Your night vision's really bad. Not really something normal humans do. Okay, well, let me turn the lights back on. Right. Note to self: humans don't do this test in darker environments. All right. Well, then maybe let's go down, like down here. Can you see this? Yeah. Okay. A little bit harder. Right. Can you just give me the first 3 letters on this line? And a J. Good. A little bit harder though. Okay. Well, I think that's a good test. Huh. I've never looked at the back of this before. Do we need to? I don't think so. No, I'm the doctor. I should know. I'm confident in your eye health about being able to read letters, so yes, I say that you're good because I'm a doctor in training. I do have one more test for you if you would be so kind. Thank you so much. I'm gonna have a lot of notes for this session, huh? And at the end, you can give me an overall score. But be fair, but be honest. I really need to pass. Alright. We're gonna check and make sure that you are able to see a lot of colors correctly. And, excuse me. Well, that's rude. Werewolves too can see color. We're not dogs. I mean, okay, sometimes it gets a little blurry the closer it is to a full moon, and things start to kind of get a little hazy, but that's neither here nor there and should not be brought up with werewolves of any kind. It's very rude. We can see color. I love color. Look at how colorful I am. So, yeah. That's right. I'm a doctor. I shouldn't be getting mad at the patient. Alright. Let me show you a few colors, and you're just gonna tell me what color it is, alright? Right, okay. Here's a good choice. Can you tell me what this color is? Yellow? Good. Alright. Fun color. Can you tell me what this color is? Blue. Good. Here's a fun one. What about this color? Red. Good. What about this one? Purple. Good. Well, I think that's all I need from you. looks like your overall eye health is kind of okay. No, I'm a doctor, and I say it's okay, even though you don't really have very good night vision. But I think maybe my human research is a little lacking. I really thought you guys had pretty okay night vision. It's really bad. So let me fill out your chart. All right. Vision test, good. A little squinty towards the bottom. Terrible night vision. And can see colors correctly, even though they thought that we were similar to dogs. And couldn't see color. I mean, how would I coordinate my outfits? I take that very seriously. I'm gonna fail this test, aren't I? Now, I pronounce you A-OK for your checkup. And speaking of you getting a good score, would you mind telling me what you're giving me if you were watching me do this for a practical exam? An 80? You're not just being nice, right? You really think so? Good job, Luna. Because I grade myself on a curve. That means I get 100. No, that's how curves work. Yeah, no, I'm pretty sure. Good job, Luna. Though before I let you leave, and remember, don't tell your scary goth friend that you were hanging out with me, okay? And I promise not to send any more of the gang of gnomes your way. I really gotta make sure I know the territories better. So we don't do that again. Can I have your phone number? Okay. And I'll text you like a little moon emoji so you know it's me. If that wasn't obvious. Okay. Oh, 4. Okay, well, you can expect this future doctor to send you a text shortly. Or later, if that's more convenient. Don't want to bear it over eager, Luna. Did you, want to catch a bite or something? Oh, that's right, you don't actually catch your food. You buy it from the store. That's right. That's not weird at all. No, I love stores. It's very fulfilling to hunt food in a store. Do they like skin it for you? Or that's a weird question, isn't it? You're busy. Oh, that's no problem. I'll text you. Thanks again for your help. You've been a lovely patient. I'll see you sometime soon. Okay. Bye. Bye. Good job, Luna. Hopefully this means you pass the next exam. I really gotta visit a store. What's that all